This research was completed by myself, Sabrina Herrera, my colleagues Katie Odell and Morgan Kelly, and our research advisor, Elizabeth Hebert. We look to increase the understanding and gain insight into parents' experiences of a young adult child with an intellectual or developmental disability on the transition process after high school. The transition process from high school to adulthood is a stressful time for any individual. There are numerous amounts of new opportunities to be considered, such as learning to drive, going to college, or even getting a job. However, for an individual with an intellectual or developmental disability, there is often a significant amount of stress added. Despite having the choice to decide which path is taken post-high school, as a typically developing individual would, individuals with an intellectual or developmental disability face more challenges and barriers. For example, challenges involving social skills, communication skills, and executive functioning skills as a result of the disability often plays a role, especially in the path that is chosen. So suddenly we are not necessarily looking at these typical milestones, but rather services and opportunities that may seem atypical to meet the needs of the individual, such as community day programs or programs like Life Prep at NAS. Due to the increased complexity of this process for an individual with an intellectual or developmental disability, the individual's parents plays a key role in advocating for their child and finding adequate and meaningful opportunities after high school. However, these parents' experiences are significantly influenced by a variety of factors, adding to their perceived stressors and supports. As a result, we ask, do the perspectives of parents of young adults with developmental disabilities on the availability of meaningful occupations vary based on community resources and supports post-high school? To support the purpose of our research, we conducted an extensive literature review in regards to the transition process of a young adult with an intellectual or developmental disability to further explore factors that play a key role in this process. One of the most prominent factors in research was family support and involvement. The higher this level of support and involvement, the better the individual's quality of life was. Their parents are their advocates in finding meaningful occupations, thus contributing to quality of life. This emphasizes the importance of parent involvement. Another common component within research was the role of the school, specifically what is expected of them and what is performed. One article touched on the role that school has in aiding these families to establish individualized goals to meet their interests, skills, and needs in finding meaningful occupations post-high school. However, according to research, there is often a lack of support from the schools. Lastly, research demonstrated availability of programs to be a barrier during this transition process. From perspectives of parents and other studies, they found it difficult to discover programs, resources, and services within their area, indicating a gap between the amount of education and information parents receive regarding this process. Overall, the literature review supported our research in which we look to further expand on these parents' experiences.
The Person-Environment Occupation, or PEO model, was one of the occupation-based models used to develop this research paper. The model focuses on the person-environment fit and the influencing interactions of the person, environment, and occupation, which are interdependent to each other. With the balance of the person-environment fit, young adults with IDD can achieve an optimal well-being and quality of life. The emergent adulthood theory was also used in this study to emphasize the focus of adulthood and that the successful transition for individuals with IDD should be on the individual's perspective of his or her roles rather than on what is considered standard role development. The participants were recruited through convenience sampling from 3 different geographic locations in New York. 6 semi-structured interviews were then conducted via face-to-face or phone calls using guided, open-ended questions in order to gain a full understanding of the parents' perceived experiences in the transition process. An interview guide was then created to further examine any barriers or resources used to find meaningful occupations for a young adult with an IDD after high school. Interviews were recorded, transcribed, and analyzed to generate common themes among the participants and their experiences. The participants consisted of 6 married females who all made above $60,000 annually. These women lived in urban, suburban, and rural areas in New York State. The young adults of the participants were between the ages of 18 to 24 and had the primary diagnoses of autism spectrum disorder or traumatic brain injury.
Through reviewing the interviews, 3 overarching themes that affected the transition process after high school were uncovered: availability of programs, school factors, and parental factors. In regard to availability of programs, parents viewed their geographic location, the program's requirements for who they accept, and the limited number of spots within the programs as aspects that made this process more difficult. The participants also identified that schools are not providing enough aid in order to make the transition process most effective. Overall, the schools are not allocating their resources in a manner that would most benefit the young adults aging out of high school. There are a lack of transition coordinators available to guide the families through the process, limited options for diplomas that would allow for success post-graduation, and overall just limited opportunities while in school for individuals with disabilities. Lastly, parental factors played the most distinct role in the transition process, specifically their involvement. Majority of the parents we interviewed were highly involved in their communities, working to develop programs that would suit their child and advocating for more support from outside agencies based on monetary funds they have available or knowledge they have on the process. Some parents mentioned that there is a lack of education provided by the community and that their knowledge was forged through connections with other parents. Based on the generated themes, there are both negative and positive aspects influencing the perspective of parents on the transition process for their young adult child after high school. It seems the external factors, such as the school factors and the availability of programs, were the most significant barriers parents identified. As researchers, it was obvious that based on the involvement and education of the parents we interviewed, their perspective of the transition process was more likely to be different than most other parents. Although geographic location was mentioned by the participants to be a potential barrier for the availability of programs, there was no true difference in the availability, or lack of, between rural, suburban, and city locations. Overall, it can be said that the most successful transition would need to involve self-educated and very involved parents, as the schools and communities are not yet adequately equipped to aid in the most beneficial manner. From an occupational therapy standpoint, advocating for individuals with disabilities throughout their high school career can help to eliminate the unpreparedness that is often seen when schools themselves are not providing information in a timely manner. We have the ability to educate the schools and the parents on how to gather the necessary resources and carry out the best plan for each individual. It became clear that there should be more research completed on this topic in order to determine the most efficient methods and resources for the transition process for this population.